About 22 million Americans who are enrolled in the Affordable Care Act, also known as Obamacare, have been receiving tax credits to pay for their health insurance premiums. They're set to expire at the end of this year. Obamacare premiums are expected to increase next year, and without the additional subsidies, will likely skyrocket.
If we don't extend the tax credits, the average American will pay from $500 to $1,000 more every month in their health care insurance. So many people will have to drop health care insurance, and they'll say, what am I going to do?
President Trump opposes extending the existing system of directly paying the insurance companies. He'd rather see the government give the money straight to the patient.
Instead of giving it to insurance companies, big, fat, bloated insurance companies, we're giving the money directly to the people to buy their own health care.
Will Americans buy it from insurance companies?
Some may. I mean, they'll be negotiating prices. It's really free enterprise. They'll be, you can do it through an insurance company. You can also buy it direct. They have savings accounts.
A number of lawmakers are expressing support for that plan.
We're not going to repeal Obamacare. We're going to fix Obamacare. You need to. Everybody ought to be able to buy plans, and everybody ought to be covered. Pre-existing conditions ought to be covered. So that would stop that. I'm not suggesting we change the structure, because I think we can drive down the cost by giving people options.
Government money deposited into Obamacare enrollee accounts could be used to pay for deductibles as well as premiums.
The president is proposing that we take the $26 billion that would be going to insurance companies if we just do a straight-out extension. And by the way, 20% of that $26 billion, 20% will go for profit and administrative overhead. Give it directly to the American people in an account in which 100% of the money is used for them to purchase health care on their own terms.
So far, Democrats are resisting the plan. Obamacare enrollees aren't the only ones seeing their health insurance increase. The roughly 165 million Americans who get health coverage through work are expected to see about a 7.5% hike in 2026. Private insurance spending has increased 80% since 2008, with hospitals, clinics, and doctors receiving the bulk. Nearly half of adults say it's difficult to afford health care costs, and 1 in 3 report putting off health care because of the cost. Lori Johnson, CBN News.